So a lot of people ask me how I found out about Liberty HealthShare. Was it they needed a spokesperson? No, not really. Was it the fact they wanted video production? No, not at the time. The person who got me involved was a doctor here in Atlanta by the name of Dr. Elaina George, and I interviewed her on my radio show. Dr. Elaina George has been honored as one of the leading physicians of the world. She is an ear, nose, and throat specialist with her own private practice. Plus, she also has her own radio show. But her interview on my radio show changed me.
There's now, under Obamacare, the health sharing ministries, specifically one called Liberty HealthShare. If people go to libertyhealthshare.org.
I had never heard of it.
So if I get this Liberty, give me the name again so I have it right.
Liberty HealthShare.
Liberty HealthShare.
I was really intrigued.
I don't want to pound this Liberty HealthShare concept, but why haven't we heard about this?
So it's great. We finally get to meet in person.
I know.
Shortly after, I joined Liberty HealthShare, and now I could interview her as a Liberty HealthShare medical expert. Did you have any idea the effect that interview had on me?
Well, I think when I mentioned Liberty HealthShare, you said, oh my God, I never heard of anything like that. And then the interview kind of just segued into me explaining that this is real. This is not something that, it sounds too good to be true. It's not. It is. It exists. And people just need to know about it.
Well, it's funny because I had the show all laid out because we were talking about the distortions of Obamacare. And into about the 5th minute, I said, what's the solution? And you bring up Liberty HealthShare.
Correct.
I threw out the rest of the show. And I kept going back to, okay, what is this Liberty HealthShare? Because really, I hadn't heard about any other solutions. And then, for me, about 2 weeks later, I'm a member. I took my time to find out. I mean, I trusted you as a doctor because I knew your reputation. Yet at the same time, too, I was like, what is this? I'm used to the way traditional healthcare has always been. Do you find that a lot with people?
No, not after they find out that the length of time that has existed, the fact that it's allowed under the Affordable Care Act, so it's not something that's out there in left field. It's part of the bill, it's written into the bill, but it's like the best kept secret. I mean, people just think there's only one way to go. And when they figure out that I don't have to spend as much, I get to choose my doctor for real, I get to choose my course of treatment, and my decision counts, then they just jump to this other level. And I think the more the people do it, the better off our whole healthcare system will be. It's about empowering people to take responsibility for their health. If people don't know something, they can't choose it. So it's all about laying out the whole cafeteria of things that you can choose. And when people figure out what's best for them, because one size doesn't fit everybody, let's face that. There are people who like to be taken care of and want to go to the traditional pathway. But I'm finding young people who really are healthy and don't think they need to spend all this extra money for stuff they're never going to need. They love this, and this is allowed into the bill. We need to really cry that out, because most people think this must be illegal somehow, or it doesn't follow the pathway, it's not going to be allowed. It is allowed. It is written as part of the law. It's just not crowed about enough, and that's what we're here to do. There's kind of a cycle here. It's like if you take responsibility, you start working directly with your doctor. Yep. You're going to start seeing medical costs come down, and then it becomes this full circle of everybody doing this. And to me, I look at the simplicity of this, and you talk about that. I mean, you talk about how it all adds up to lower cost, healthier people. That's what it's all about. It should be a healthcare system, not a disease-driven system. And we talk about it. Everybody talks about prevention and wellness. But you have to walk it here. I mean, people are choosing this because they want to, not because someone's making them do it. That's what makes this really powerful. It's voluntary. This is a consortium of people like-minded who want to take responsibility for themselves, their healthcare dollar, and they want to choose things that promote health, choose a healthy lifestyle. It just so happens that it's going to be cheaper, you're going to have more choice, you're going to have quality, so it's kind of a win-win for everybody. It's kind of a mission, and what I really enjoyed talking to you about was you weren't just a doctor talking about being a doctor, you were saying, let's find solutions. And that's one of the things I really try to do on my radio show and the things that I talk about. Let's find solutions. Agreed. What I love about the members of Liberty HealthShare is they're on a mission. And the mission is, let's get everybody on this so we're all working together. Do you find that with people that? Absolutely. And it's not, even though it's a parallel track, It does have the benefit of helping people who stay within the regular healthcare system, the old-fashioned healthcare system, if you want to put it that way. Because the more people that are able to take care of themselves, they're not all lumped into the same pot, because there is a finite amount of money there, where there's not going to be enough money to take care of everybody who gets ill. We already know that. They've said that. It's not going to get better. No matter how much more money gets pumped in, it's still finite. So if other people find a path that will keep them healthy, keep them out of the hospital system, help them live long, productive lives, everybody wins.
And they get to save some money on top of it.
There you go. And use it for other things.
Elaina, thank you so much.
It's my
thank
pleasure.
you for getting me to be a part of Liberty Health Share. You didn't even realize you were doing it.
I didn't. I'm spreading the word.
Yeah, it was great. Well, I thank you so much for that. And it's all about Liberty Health Share. It's also about sharing the news and also learning about what is going on in the healthcare system, because when you do, you'll be a part of Liberty Health Share.
Absolutely.